Good morning and good afternoon, everyone. Before we begin, I want to say that there is translation, as I'm understanding, in Galashisut available, and you can click the globe icon to turn it on. My name is Tupalnak, and I am honored to welcome you to the 6-week webinar speaker series focused on strengthening the health and well-being of Inuit children and families across Inuit Nunaat. I want to begin by acknowledging the Inuit lands and waters across Inuit Nunaat, where participants are joining from today, as well as the lands that others are joining us from, including where I'm from, Treaty 6, where I am, Treaty 6 and 8 territory. We recognize the strength, resilience, and leadership of Inuit communities, and we thank you for taking the time to be with us here. Your presence reflects a shared commitment to supporting Inuit families and children and future generations. This webinar speaker series is grounded in Inuit knowledge, lived experience, and community leadership. It's about visioning together and learning from one another what a full continuum of care could look like for Inuit children and families. We are so grateful for all the speakers, partners, and participants who are contributing to this important dialogue. And thank you to Rhoda, Cindy, and Elika, our translators, for making this accessible for everyone. And thank you also to Corinne, our digital note taker, for turning this series into visuals. Over the next 6 weeks, we will focus on different components of health and wellness for Inuit across Inuit Nunaat. We will invite Inuit speakers from across Inuit Nunaat and organizations to share insights, promising practices, and community-led projects. And please feel free to use the chat or the Q&A to share reflections, questions, and experience, and we will do our best to answer them. Each webinar will be recorded, and some parts may be shared on ICC's website and social media. And this is today's agenda. First, we will do some welcome and introductions, and then we'll talk about the project overview. What is the purpose of this project, the purpose of the next 6-week speaker series. And then we have a speaker today, Abra Nungasuk Patkotak. And we'll have a break. And at the end, we'll have Q&A sessions where you can ask questions and yeah. And here, if you don't mind submitting where you are tuning in from. We already got some of you, but please write down on here, where you're from, where you are today. I hope you can see that.
Yes, so I actually just sent a link in the chat, and so you will have the public version of this presentation available. If you click the link and then you go on to this specific slide, then you can submit where you're from. It's very optional if you want, but you're welcome to leave where you're tuning in from.
Yeah, thank you. I think this is also where I give the floor to you. I was like, give the ground to you, Melinda. The next slide is you.
Yes, perfect. Thank you, Tupangnak. And yes, thank you for welcoming our guest speakers. And as you can see, some of the videos that are up are some of the panelists for the future speaker series. But I wanted to hop on here to just share a little bit more about the project itself and why the speaker series became a thing and why we thought it was important. Um, so I'd like to first, I guess I'll introduce myself. My name is Melinda Hallowak. I'm originally from Inuit Nunavut or Cambridge Bay, which is on the western side of Nunavut. I currently live in Edmonton, Alberta right now while my husband is attending school. I've worked for the Inuit Circumpolar Council for almost 2 years now within the health file. And it's been a bit of a learning curve for me. I have a background in nursing. I was a registered nurse for 5 or 6 years. So yeah, nice to see so many attendees and nice to see the panelists' faces. Very grateful for the outcome with such a large audience today, being the first launch of our speaker series. So I'll start off by I'd like to acknowledge the generous support of our funder, Novo Nordisk Canada. Through their financial support, they've helped to make this speaker series possible, and their support helps create space for Inuit-led dialogue, knowledge sharing, and the development of culturally grounded approaches that strengthen families and communities across Inuit Nunaat. So thank you to our funders. We are very grateful to have made this speaker series possible through them. So I think Tupangnak shared a little bit about the speaker series, and so I'll get into a little bit more. But this speaker series will be over the span of 6 weeks, so it'll start today, and then for the next 6 weeks, every Wednesday we'll have the same webinar series to invite different speakers from all across Inuit Nunaat to share different components of health and wellness for Inuit across Inuit Nunaat. We'll invite Inuit individuals, but as Inuit organizations as well, to share insights, promising practices, community-led initiatives, and projects, and to hear the voices of Inuit on what pillars and values are supporting the health and wellness of Inuit. As Tupangnak said, please feel free to use the chat to share reflections, questions, and experiences throughout the series. We will kind of take all of those in, and throughout the series, we'll try to answer some of the more frequent questions, but hopefully we can get through all of the questions. I think Tupangnak mentioned that each webinar will be recorded, and some parts of the series will be shared on our website and social media. So at the end of this webinar, there will be the option to engage with the speaker and the panelists to hear a bit more about their work and to ask questions. So if you do come on screen, just please be aware that your video will be recorded. So I'll share a little bit of background on where this project and the speaker series was first coined. When ICC was working on our strategic health plan, ICC had invited many individuals, including the Circumpolar Inuit Health Steering Committee members, or for short, CIHSC, to come together to create our strategic health plan. The CIHSC is led by the Inuit Circumpolar Council, and it comprises of 2 members from Alaska, 2 members from Canada, and 2 members from Greenland that are knowledgeable in health and wellness across Inuit Nunaat or specific to their country or their region of Inuit Nunaat. So through their work, it was realized that across Inuit Nunaat, no region or no country or no area currently benefits from a full coordinated continuum of services that support Inuit children and families at every stage of life. And too often we are working through fragmented systems that don't come together and that do not fully reflect Inuit ways of knowing, being, and doing. So, without a shared vision of what a complete continuum of care could look like, it is difficult to strengthen systems or to advocate for meaningful change. So, this speaker series is part of a broader effort to explore what a continuum could look like, highlight promising practices, programs, initiatives, and community-led projects. To identify key pillars and values rooted in Inuit knowledge, and to strengthen collective understanding and unity, which is something that ICC it essentially is our mandate to promote unity of Inuit across Inuit Nunaat. So ultimately, this speaker series is about knowledge mobilization, highlighting successful and impactful work across Inuit Nunaat, building clarity, alignment, and unity, and providing momentum with the vision of building an Inuit-led continuum in the future. So really this first part of the project is more of the very optimistic, exciting part of the project where we just get to listen to Inuit voices and Inuit projects and the things that are happening in our communities and in our homeland.
Thank you so much, Melinda, for that, for that presentation and telling us why you chose to do this project. And I'm very grateful for you. And thank you so much for all your hard work to get to this now. Okay, the next, it is my pleasure to introduce Abra Nungasuk Patkotak as our very first speaker. Abra is Iñupiaq from Utqiagvik, Alaska. Abra is a birth worker, doula, and co-founder of the Alaska Native Birthworkers Community. It's a role through which she advances reproductive justice while serving Indigenous birthing people. She serves as a core committee member with the State of Alaska Maternal Child Death Review. In this role, she brings knowledge of Alaska Native culture as well as lived experience with rural healthcare and rural emergency response systems. She has held many roles, including managing the pre-maternal home for Utqiagvik and the surrounding North Slope communities. She has also worked as a 911 dispatcher in the Arctic. Abra currently resides in the Dgheyey Kaq, also known as Anchorage, on Dena'ina land. Everybody, please welcome Abra. So I think, Abra, do you have slides? So I think I'm going to stop sharing and then you can share.
Yeah, Koyanak Tapanak. And Melinda and everyone, it's so nice to be here. It's still morning here. I love that we're across all different time zones, different times of the day. And it was nice to see from some of you where you were calling in from, zooming in from. Let me get ready to share my slides here. I have a presentation. And like Tupanak said, I'm Iñupiaq from Utqiagvik. My Iñupiaq name is Nungasuk after my Aka Susan Nungasuk. And now I live in Anchorage, and it's about 750 miles south of Utqiagvik. And Utqiagvik is the northernmost community in the United States. I believe it's the 9th most northern community that's inhabited in the world, but I need to double check that. But we're pretty far north on the Arctic Ocean, and I'm so excited to see a lot of people names I recognize in the attendee list, and then familiar faces here on Zoom. And I'm so excited about this series because we are so brilliant what we're doing in our respective places. I think the more we can learn from each other about ways we could support families, the better we will be. And this is just a presentation. Oh, actually, I have one quick question before I go, just to work backwards for time. How much time would we like for question and answers so I don't get too carried away with my presentation?
We have around 30 minutes,
That's
maybe.
perfect.
Yeah,
Okay, perfect. So it's
that's
8:43.
at the end for
Okay.
everyone. And then we also have like guided questions for, so you have till around 11:10, I would say.
Okay,
Yeah.
great. Let me share my slides now. And I just need to hit the slideshow. Okay, how does that look for everyone?
It looks great.
Wonderful. So this is just the opening slide, and our organization is called Alaska Native Birthworkers Community. And this presentation is called Sovereignty from First Breath. So there's four of us co-directors, and my colleagues actually created this, but I'm sharing it today. Oh, and let me see if I can advance. There we go. So the Alaska Native Birthworkers Community, we're a community-based group of full-spectrum Indigenous birth helpers and reproductive justice advocates. And over time, we've organized to reclaim Indigenous birth practices and to support Native families from preconception through postpartum with culturally matched care. And in this picture, you could see there were originally 6 of us who started the organization: Stacy, Margaret, Lena, myself, Utqiagvik, and Stephanie. And a little bit about how we came together. We started organizing in 2017. This picture is at the hospital in Anchorage, where most of the babies are born. There's around 1,500 Alaska Native babies born at the Alaska Native Medical Center, and over 50% of those are born to families from rural Alaska who fly in. So I think we can all relate to that across Inuit Nunaat. We share that many of our people have to travel great distances today in order to give birth. And this isn't true for everyone. I know someone was calling in from Nunavik, and my friend Brenda there is a midwife, and I know there's Inuit midwives from across Inuit Nunaat who are working to reclaim birth as a right in our communities, and that's so exciting. I can't wait to get to know you all better. A little bit more about our vision, mission, and values. Our vision is that our communities are reconnected to birth through reclamation of ancestral knowledge and exercising sovereignty from birth. Our mission is to serve Alaska Native birthing families so they feel supported, well cared for, and full of the information they need to make confident choices around reproductive health, birthing, and parenthood. In doing this, we seek to reclaim as well as create new ceremony to heal our ancestors, ourselves, and future generations who may have been harmed through the colonization of our bodies, healthcare, and birthing practices. And our values are responsibility to community, culturally matched care, connection to land and waters, and upholding ceremony and cultural teachings. Our current care is focused on 3 areas. We call them 3 sisters of support. And this art here is by Iñupiaq. And the first sister is supporting Native birthing families, and that's through our team of birth helpers. We go to right now in Anchorage area where families are at, which is either the hospital, birth center, or home. Our second sister is growing a statewide network of trained Native birth workers, and our third sister is collaborating with partners for systemic change to better support Native and rural birthing families. We host community wellness events, so we have bi-weekly drop-in visiting circles. We do traditional arts workshops, traditional knowledge, virtual sharing circles, and childbirth preparation retreats. You could see these pictures here are from our childbirth preparation retreats, where we teach about healthy pregnancy, we give foot soaks, we give out tea that we make. Margaret here on our team is an Athabascan midwife, and she created our tea blend that we share with families and also created the entire curriculum that we use to teach about a healthy pregnancy for Native families. And then on Zoom, we have some recordings. Rose, who's on here. Hi, Rose. Rose was one of the hosts of one of our sharing circles that we have on our YouTube. And some of them are publicly available and others are for Inuit. So if you, there's a process where you can request it if you would like to view it. And there's a picture of some of our teas and different herbal iron syrups that we make to support healthy pregnancy. Some of our, these are pictures from our events. Some of our events, sorry, I have a little bit of I'm recovering from a cold. So if you hear me sniffle and I'm kind of groggy or froggy. In 2021, we had the full spectrum Indigenous doula training. And we also had the Indigenous lactation counselor training. In 2022, we held the Indigenous childbirth educator training. In 2023, for the first time ever, we went to Sitnasoak, also known as Nome, and that's this picture here on the left at the Utqiagvik Cultural Center. That was amazing. We that was the first time we ever held a gathering outside of Anchorage, and we went up to Nome, which is on Inuit Nunaat, and it was so beautiful. And we held our training there. And we also have virtual networking circles and skill shares. And I need to update this because we also had a birth helper training in 2024, but we just held another lactation training in November 2025. So you can see some of these were during the pandemic, and we did kind of a hybrid virtual gathering. So these are just some of our trainings that we're working on getting more birth helpers across the state trained. For those of you who don't know, in Alaska, we have around 200,000 Alaska Native people, but that's not all Inuit. There's a combination from all Alaska Natives. So some things that we just know to be true. We know that Indigenous people have supported each other during childbirth since time immemorial. And we use the word birth helper. In my language for Iñupiaq, the word for midwife was Iñupiaq. And in my region in the 1990s, there were still Inuit midwives practicing. And then because the way our healthcare system is set up in Alaska, with no fault to them, they died without transmitting their knowledge. So now there's a resurgence of reclaiming our roles that we always held traditionally. And in my own family lineage, there were midwives and people who helped during labor and birth. So a lot of this is reclaiming. And then I also hope to visit Canada next summer and meet with Inuit midwives there. So for our team, we have birth helpers, and that's someone who is there for providing continuous physical, emotional, spiritual, and informational support before, during, and after childbirth, and through that full spectrum of reproductive health experiences. So also through loss, perhaps through adoption, through rites of passage. And we're different than a midwife. Our team currently, as birth helpers, we're there to share information, to share resources, to be that one-on-one support during labor, to offer a continuous supportive presence, to help create a comfortable environment, provide reassurance, and support decisions. Oops. Oh dear. There we go. help with comfort techniques and support entire families, and also help with breastfeeding and postpartum. But our team, we're not midwives. We do have 2 midwives on our team, and I'm a student midwife, but currently we're there for that support. And let me check. Okay, yeah, let me get through some of these slides. The research shows that having a trained labor companion will lead to the pregnant person being more likely to have a spontaneous vaginal birth, less likely to need Pitocin, more likely to have a shorter labor than they would have otherwise, less likely to have a cesarean birth, less likely to use any pain medication, and more likely to have positive feelings about their childbirth experience. This is specifically for Alaska, so we currently only support people who are from Alaska or in Alaska. We have a website, and if you're here in Alaska and you are Alaska Native, we have a team available for support. So you can request that matched birth support where we can be there for you throughout your preconception, pregnancy, labor, birth, and postpartum period. We also partner with our hospital that I mentioned at the beginning to offer on-call support. So we have a birth support person who's on call 24/7, and we take turns. We're on call for about a week, and then the next person is on call, and there's also a backup person. So if the first birth helper gets called in to join a family, then the backup person's available. And this is because, as I shared before, many families are alone. They're sent hundreds or over 1,000 miles away to be at the hospital. They might be there for weeks at a time beforehand, and they perhaps have left their partner or their children at home. So we really created this org so people don't have to be alone during labor and birth. And then this is just about the context and perspective of what people go through. And I know there will be similarities, I'm sure, that I'm excited to hear about during questions and answers of what other people experience in Canada and in Greenland. So we know that our birthright is that we are born into sovereignty. From our very first breath on earth, through the reclamation of our power during rites of passage, rooted in ancestral knowledge, and that each birthing person is surrounded by their community in connection to their sacred lands and waters. We do this work in order to heal our ancestors. So this is a quote from Dr. Rita Pitka Blumenstein, who was a Yupik tribal doctor and traditional midwife. We are our ancestors. When we can heal ourselves, we heal our ancestors, our grandmothers, grandfathers, and our children. When we heal ourselves, we heal Mother Earth. We also know that water is life, and that Indigenous populations across the U.S. disproportionately experience health disparities, maternal mortality, and infant mortality rates. So that's another thing, bringing it back to policy. I serve on the Maternal Child Death Review because here in Alaska, around 56% of the deaths in Alaska are Alaska Native women, Indigenous women, even though we only make up 15 to 20% of the population. But we also know that that's not our fault. So through the harms of colonization, the violence in which we have been separated from our culture and the knowledge that we deserve to keep ourselves safe, this is a harm that doesn't belong to us. So collectively, as we reclaim our practices and as we care for our communities in a way that's loving and good, we can eventually just have better experiences. And as Aviaya and I were sharing at the very beginning before the presentation, our healthcare system is often causes harm. And even if we're doing better and improving things, there's still so much hurt that happens through the healthcare system. So hopefully over time we can reclaim our practices as our own and uplift each other to heal through this. This is here we do this presentation for all kinds of people. So I think this one I don't really need to spend much time on, but a lot of times in Alaska, this has come up, well, who's Indigenous? So this is kind of a slide about who we serve here in Alaska. So this is a brief overview of Indigenous people in Alaska. We have 229 recognized Alaska Native tribes. 20 Indigenous language are official state languages. There's approximately 200,000 Alaska Native and American Indian people in Alaska who are eligible to receive care through the Tribal Healthcare Center. 40% live here in this South Central region, and then the rest are in rural Alaska. And you could see here where the Inuit are in Alaska. I love this map. It's a language map, but I think it's so beautiful. A little bit about our Alaska Native worldview. We know that awareness of the interdependence of humanity with the environment, a reverence for and a sense of responsibility for protecting the environment. And another quote from Dr. Rita, in order for a person to be whole, they must feed their mind, body, and spirit equally to heal themselves. One of the harms of being separated from your community when you're waiting to have a baby is that you're also removed from your food. And as we know, food is of course it's important. We need to eat it every day, but our Iñupiaq, our real food, that is what heals us. And when we're away in the city, it's hard to be healthy and well. So there's just so many ways that when we're pregnant and we're separated from our community, the harm is just compounded. Like it's just hard. It's very difficult. This picture is at the hospital here in Anchorage. It's a dance group. There's often dances happening in the rotunda, in the circle area at the hospital, which is really healing, really beautiful. Some of our Alaska Native values, which just an example of them. This is from Molly of Denali. Showing respect to others, sharing what you have, knowing who you are, accepting what life brings, having patience, living carefully, taking care of others, honoring your elders, and seeing connections. These are just some of the structural impacts on Alaska Native well-being. Not all, or this isn't comprehensive, but this is pretty good. The blue is Alaska history, and then the orange is the Indigenous health system in the United States or Alaska, and then the black is the US history. So in the 1700s, the Russian colonization and fur trade happened. In 1824, in the United States, we had tribal treaties. The treaties included health care, but they were housed under the War Department. So that kind of gives you an example of how our healthcare began. And in 1849, the Bureau of Indian Affairs was formed. I'll stay with the orange here. In 1955, the Indian Health Service was formed. And that's where for Indigenous people in the United States who are American Indian or Alaska Native, most of us are eligible to receive this Indian health care. And then in 1960s, there was the Community Health Aid Program. And then in 1970s, similar to other communities across the globe, honestly, there was the forced sterilization of Alaska Native women that happened here. And then in 1997, the Alaska Native Tribal Healthcare Consortium began. So we in Alaska, we talk about how our healthcare is tribally owned. And here in Anchorage, we're called customer owners, which is interesting. But our hospital is very beautiful. I think it's a great facility, but there is also always so much room for improvement. Even though our hospital is a midwifery-based practice with midwives, there are very few Alaska Native midwives. So Margaret, Inga, and Shannon, and there might be more. There's at least 3 Alaska Native midwives. So slowly we're shifting towards having more midwives from our communities who are there. And then a little bit in the blue, I know that we can relate to these, even though these are United States things that happen, but there was the Great Death in 1900s to 1910. There were internment camps in the 1940s. In the late 1800s was the start of boarding schools. Alaska became a state in 1959. Oil was found in 1967. And then the Alaska Native claims began in 1971. In 1983, the last federal boarding school closed, but we still have Mount Edgecombe High School, which opened in 1985. So students today are still sent to boarding school here in Alaska. This slide talks about colonialism and colonization and kind of what I've been saying, how we lost midwifery here. Colonialism is the historical and ongoing policy or practices of acquiring political control over another country or land, occupying it with settlers, and exploiting it. Colonization is the process of devaluing and dehumanizing Indigenous people through both formal and informal methods in order to justify exploiting them and their homelands. And this is a picture from sometime in the 1900s, and the picture on the wall says, "Do not speak Eskimo." So just the pain and the way that our language was taken from us is, yeah, it's very hard. The history of midwifery in Alaska, you can see here in Savunga, there was a midwife who was a midwife at work in the 1940s. And then in 1951, you can see a nurse coming in and showing basically saying that this Western model of healthcare is going to replace our Indigenous and traditional knowledge. This is a traditional Indigenous midwife, Dgheyey Kaq, who was an Iñupiaq midwife and traditional healer from near Noatak in 1952. And traditional midwives were retrained into non-native medical healthcare systems. Evacuation policy became routine. So all births were or are removed from the villages, and many rural Alaskans cannot receive perinatal health care or give birth with any medical support in their communities. So most communities that are rural in Alaska, they have a small health clinic that is staffed by individuals called community health aides, and they're not midwives or doctors. And through their training, they're not supported for people to give birth in their communities. So in the next few slides, you can I'll show a little bit about how far people have to travel. So colonialism has shaped maternity care. Our traditional roles and knowledge were inferiorized when new models of healthcare were introduced, and traditional roles and knowledge are not passed on. Pregnancy, birth, and postpartum care is routinely referred out of rural communities, away from support systems, traditions, and cultural practices. When rural and Alaska Native women are removed from their homes for extended periods of time, they cannot fill essential roles, which are inherent to the stability and prosperity of their communities. When we look at these disparities that we're facing, when we wonder why are Alaska Native women experiencing the highest rate of maternal mortality, Why are we seeing so much domestic violence? Why are communities struggling so much? What is shocking to me is that there has been no comprehensive study or look at the damage of when you remove someone from her community. But it's not just someone, it's everyone. Eh, anytime a woman gets pregnant in most of these rural communities, they have to leave. So what does that mean for the community? What does that mean for her family? What does it look like for her children that have to stay home and her husband that has to stay home? Just the pressure and stress that's put on families. I know many of you can either you've experienced this firsthand or you can relate to this harm. Most rural Alaska Native people birth far from home, and I've shared some of these statistics already. Per Alaska Vital Statistics, there are about 2,000 Alaska Native babies born each year. Healthy rural pregnant patients leave home weeks ahead of their estimated due date to await their birth at the regional hub, often alone. Um, and I will say that for some families, this is maybe months. So if there's anything going on with the higher risk, I've supported some moms who were here at the hospital. I'm pointing behind my shoulder because it's that way. They were here for 6 months alone. So one mom, she was all alone in a little tiny room for 6 months, and it's just so painful. About half of the births at ANMC are to people who live outside of the Anchorage service area or further than 90 miles away. Medicaid insurance does not cover travel for a support person except when the patient is a minor. There's a very limited support for people to have a companion to travel with. So not only are you just giving birth, but then you're taking a tiny infant and you're getting on multiple planes by yourself with 6 weeks of luggage and shopping and groceries to carry. So a little bit about just the size of Alaska. It's funny, we're using the United States here. Um, it's kind of it's just wild how large Alaska is and how far people have to travel. So this is my region up here on the pink Arctic Slope Native Association, and we have a hospital, Samuel Simmons Memorial Hospital. Um, Over 70% of pregnancies are referred to here to South Central Foundation, so 750 miles south to Anchorage. Even though we do have a labor and delivery unit, we have obstetricians there, and they recently actually just built a operating room to be able to do C-sections here at this hospital, but we still don't have midwives, even though traditionally we had midwives at every birth. So, but this just kind of shows the distances that families are traveling and how often. So here on the North Slope, we have 8 communities and they're off the road system. So people are flying from these smaller hub communities of Point Hope, Point Lay, Wainwright, Nuiqsut, Kaktovik, Iñupiaq Pass, and they're flying and Utqiagvik, over here. They fly into Barrow, or we changed the name. It used to be called Barrow. Many people still say Barrow. You're flying into Barrow or Utqiagvik and you're staying here. That family may stay there, or then they may fly even further onto Anchorage. And it's a huge burden. It's a huge burden for these families. And it's just normalized as it is I know in Canada and Greenland too, that we're just expected to go through this great travel to give birth. And you can also see on this graph here that the number of births at the regional facilities is decreasing, and it's increasing at Alaska Native Medical Center. So over time, now in 2020, it used to be that there were more births in places, let's see, like in these outer regions. So there was more people at least staying somewhat closer to their communities. Now we're seeing more and more people are in Anchorage, in the big city. This is a quick overview of birth as a rural person. So an example would be here in this longer building. I don't know if you could see my mouse pointing, but that would be an example of the regional or the community clinic. And then someone would take a small plane and go to Utqiagvik here. This is the prematernal home. This is me. I used to work here, and I ran that home. Moms would come and stay for weeks at a time, or sometimes overnight, just on their way to Anchorage. And then you get on a bigger jet plane, and then you fly into this is Bethel or Anchorage. So it's just many, many planes, maybe four-wheelers and snow machines to get to the plane, and then multiple flights to get to Anchorage. And I'll share one example that I always remember. I was supporting a mom. She was staying with me here at this purple house, the prematernal home. She had a history of precipitous labor, precipitous birth, which means her previous birth, her baby came very quickly. Her baby, before this baby was born, within 1 hour when her labor started. And she had hit her due date, and she was 1 day past her due date. And instead of sending her on a medevac, her nurse decided to put her on the commercial jet by herself, even though she had a history of giving birth so quickly. And I was young. I was in my 20s. This was over 10 years ago. Today, I would have said, absolutely not. That's not safe. Do you want her to give birth unassisted on a commercial jet? But this mom, I remember calling her because I was worried, and she had given birth within 1 hour of the plane landing in Anchorage. And she didn't even want to leave. She wanted to stay in Barrow. She wanted to be here where she had been staying for weeks. It was completely unnecessary. So there's many choices that are made without consent or input from families. And the decision-making process for these choices often feels arbitrary and not in the best interest of families. So I've already said this, but I'll just say it again. Birth for Alaska Native people is almost always in a hospital setting, usually away from their own community traditions and practices. Evacuation is mandatory for rural pregnant people. And often the reason that these mothers are sent out is they're deemed high risk. And a lot of times it's even if the high risk determination might be even if it's your first baby. So there was 1 month a couple years ago where I supported 6 Iñupiaq moms. I was at their births, and every single birth, there was no medical reason for them to be in Anchorage. So there's a lot of fear, but often the outcome is good. And we're at the place now where how do we find this balance of supporting birth safely for communities and supporting people to stay in their communities if that's what they want. I think it's exciting I want to learn more too from other regions about how to support that, increase that local support, because that's what our people deserve if that's what they want. So how can we support Alaska Native families? We can become familiar with cultures and histories, um, become familiar with structural impacts that we are experiencing today. We need to uplift healing-centered care and practice trauma-informed care. We need to uplift traditions as best practices and honor that our people hold the answers. We can continue to uplift community-based solutions as Melinda and Tuparnuk are doing with this speaker series. Understand what we're doing to uplift and support families, and uphold cultural safety. This is more for other people, like if nurses were to take this course, but a little bit, this is good for if you're a healthcare provider caring for Inuit. If you are if you're not Inuit and you're serving Inuit people, oh man, sorry, that's redundant. Serving Inuit, take this course, understand where we're from, understand what people are going through, and the pain of being removed from your community, and also hold that knowledge that when you are removed from your community and the way people show up, it's have compassion and understanding for how difficult it is to be away from the community during birth. And what are some questions to consider as we collectively dream what the future might look like? Who decides our birth options? How does the way we birth impact maternal, child, family, and community health? What do these choices mean for growing families? This slide is about rematriation, and there's some just beautiful images from across the North America. This is Brenda Epu. I don't know. Put in the chat or the Q&A if you know Brenda. She's traveling today, so she couldn't be here. But Brenda is a midwife in Iñupiaq who supports families there. And I had the honor of meeting her about a year and a half ago and have been able to spend time with her. And this next picture is in a hogan, a Navajo hogan or I believe, I'm actually not sure, but it's a hogan somewhere. And then this is in Arizona, someone using their traditional straps to support during birth. And then this is my friend Kala, and she gave birth at Standing Rock during the Standing Rock movement almost a decade ago now to her daughter Minnie Wachoni. And she's an incredible and fierce advocate for our birthing and reproductive rights. And a little bit more about how you can connect with us. We have a website, we have a team. Let me see. Oops, I went over a little bit. Sorry, you said till 9:10. It's 9:20.
No worries.
Yeah, feel free to just find us on Instagram. I think we even have a TikTok now, but we're very active on Facebook. You can email me and I'll stop sharing. One more thing before I finish speaking. I didn't share about our teammates, because there was a slide. I just want to uplift them and show you our beautiful team really quickly. I'll just share my screen once more. Okay, hold on here. Let me open this. Okay. So this is our teammates, which you can also see on our website, but I just wanted to show you their faces. And we're very busy. I think last week, I want to say there were at least 3 or 4 births that we supported. And yeah, it's just exciting what we're able to do, the healing that has happened when these people are connected to families in birth and there to uplift and support them. So yeah, I'll stop sharing. You can also see this on our website. And there's a lot more to see there. But thank you everyone for listening. I'm looking forward to questions.
Thank you so, so much, Abra, for your beautiful presentation. I already feel the purpose of the speaker series, how much value it'll give to all the regions. Thank you. Everyone, we're going to take a short break, and then afterwards we're going to open the floor to all of you for questions. Now the chat is working. Yay. So let's start again in my time, 11:30. So 7 minutes from now, everybody. And then we'll open the floor for questions. Thank you, everybody. See you in 5. Have some water, stretch your legs, make some tea. Welcome back, everybody. I hope you stretched your legs, had some water, and maybe thought about questions you might have for Abra. If you have questions already, please put them in the chat. I don't think it's possible to unmute ourselves, unmute you, so questions should just be in the chat. And Melinda will help moderate. Aviaya has a question. Oh, Aviaya, you have to change it into everyone. Oh, you can just ask, hi, baby.
I have the baby now.
Good morning, baby.
Oh, you're gonna wave? Say hi.
Oh, okay. So Aviaya has a question, and Aviaya, I believe that you can just, if you want, unmute yourself and ask your question, or put it in the chat. And if you put it in the chat, make sure that you send it to everyone and not just host and panelists, if it makes sense.
And I think that Aviaya, I was able to promote you to a panelist, so you should be able to share your screen now.
Okay. Do you hear me?
Yep.
So do I just should I write it down or just ask my question?
It's up to you. You can do
thank
either
you.
or.
Yeah, I would like to ask, you know, thank you so much, Abra. It's such a big work that you are doing. And we don't really see the same Indigenous-led work in Greenland. And one of the things that make me think is that we still have a very colonial influenced way of thinking that only like Western trained birth workers or nurses or doctors are allowed to do such work, if you understand what I mean. It's like there's kind of a distrust, like if you are not professional, if you don't have a white man's education. So that's kind of the system, the way it's made in Greenland. It's like if you want to help someone with the mental issues, I mean, you need to be Western educated as a psychologist or something. Otherwise, it's not approved. So my question is, how do you influence the policymakers and people giving the grants to you that indigenous ways that you are using are absolutely good as they are, if you know what I mean? I don't know if my question is clear.
No, I totally know what you're asking.
Okay,
No,
thank you so much.
yes, and I think it's similar to what Aka, if I'm pronouncing it right, Hansen asked the same, similar, like, what do we do to create that system change? And I think one thing that's a little difficult across our we have so many similarities, but then when it comes to structure and funding of our healthcare systems, it's so different. And Malaya and I were talking about this when she came to visit me in Alaska. I showed her our healthcare system, and she was telling me how different it is in Canada. And then I know it's also even more different in Greenland. And one thing we did is, and so Margaret David, who I talked about in the presentation, she is incredible. She's very brilliant. She's a midwife. She's Athabascan. She's not Inuit. She's one of our co-creators. She actually wanted to do a doula program that like we have now within the healthcare system. And then she realized it needed to come from outside and that it had to be led by community members. So that's one thing that we were very clear about. We wanted this to be led by community because there's so much distrust within our healthcare system. And the approach that we took, which might be difficult in other countries, is that we are totally grant funded. So in the United States, we have lots of philanthropy. But then I guess an example would be we really don't have funding. Like in Canada, you have so much funding for research and for education. And there's really good research coming out of Canada about like forced evacuation for birth. And that's something that we just don't have in the United States as much. So I think one of the important things though is having like-minded people and kind of having that shared mission. So we knew we wanted to support pregnancy and birth, and we had that strong collective goal. And then Lena, she did our fundraising, but currently all of our funds are from private philanthropy grants. So example would be like W.K. Kellogg Foundation, kind of similar to what, you said Novo Nordisk is funding this. So people who want to give money to Inuit-led initiatives. And I don't know how that would work in other countries because I really only know how it works in Alaska. But I do know that the importance of this initiative being led by Indigenous people from the community is what's made it so successful. And I will say too, we have really seen a shift in at least the hospital here in Anchorage. And I'm hoping as we grow and over time, then we can make that shift in our smaller communities too. But staying in the community, being community led, and really that makes us also answer to the community. So we're responsive to them. So we hear what our people want and then answer it. And I think that's really important. But we're also a collective. And so we do have the 4 co-directors, but we work together to make sure that there's not just one person making a choice for everyone, kind of having that more like community minded. And that's been really good too, to be a collective of people instead of just being like one person in charge. So I hope that answers the question. And I'd like to workshop that more and just like think about ways that these community-led orgs can exist in other places too, because it is really positive, but we also still have so much to do.
Yeah, thank you so much, both Aga and Aviaya, for those questions. I really like the part where you said that it's community-led. So it's not far from your organization to the community. So you can make the changes quick, and it's not the systems that kind of can make it hard. So I really appreciate that. And it's also hard for you to answer how to change the systems in Greenland. But that's why it's so good that some of us are here to hear what you have to say. Does anyone else have a question? You can raise your hand. I feel like we have time for 2 more questions, depending on the conversation.
I think I see Diane's hand up, so I'm going to click the allow to talk, Diane, and then Minnie had her hand raised up next. So I'll unmute you, Diane Gautier. I think I'm saying your last name correctly. I'll just wait 1 second to see if she's able to unmute. Okay, maybe I'll move to Minnie. Minnie, I see your hand is up, so I'm just going to click the button here. Okay,
Hi.
Minnie, there we go.
I'm so sorry I couldn't join at all. I was having a really hard time connecting. And Melinda, thank you for keeping me up to date. And I checked my emails, and there you were. And I have finally connected. I'm so sorry I've missed most of the session, but I'm here. I don't have any questions because I didn't hear much.
No, Minnie, it wasn't just you. We were having a lot of technical difficulties at the very beginning, including trying to get the Inuktitut translators on board. We were able to get Aleka, who's doing the Galahlisut translation. So it wasn't just you. This is the first webinar of 6. So I hope and pray that all of the technical issues for next week will be all ironed out. So it wasn't just you. I think it's just a matter of me unlocking some of the webinar features. It's something that's very new to me. It's a very uphill learning curve for me. So it wasn't just you, Minnie, but I'm very happy to see that you were able to make it on. And just for the audience, Minnie and Mina, who are both in the attendees section here, will be panelists for a future series. So very happy that you could make it for a little bit, Minnie.
Thank you. Can you see me?
No, we can't see you. I can't figure out also how to figure out
Okay. Thank you.
the video function. Is there any other questions? I see that Diane's hand is still up, but I'm gonna lower it unless, Diane, you had a question.
I do see, and Aka said, what do we need to do so that we see a change and a more safe beginning for Inuit babies? And I think that's a really good question, how we can change the system. I will speak to that too. I kind of spoke to that a little bit with Aviaya's question, but I think one of the most important things is to know what your community wants and then speak up for it. And also see when there is injustices happening, really just get creative in how we can correct those injustices. And then the other thing is not normalizing harm. But it's hard. It's really hard. So, one of the most painful things I heard through the care that we offer, and we've been to many, many births. Our team last year alone supported 104 births. And that's beautiful. That's just a really beautiful accomplishment. I just have to uplift our team. And one thing I didn't say in our chat, all of our services are free. We don't charge any money for anything we offer, including our training. So we've never asked anyone for money, but that's a privilege through our grant funding that we have. But I think one of the most important things when we look to change things is to see when things are wrong and then really get creative in how we can change it and stand up to when there are wrongs. But going back to what I was saying, one of the families we supported, it's really sad for me to think of this, but she said, I was not her birth helper. She had a different person from our team, but she shared that she was grateful for the care, but as soon as one of our people from our team came in the room, the doctor started treating her differently. And in some ways that's good because that's why we're there. We're there um, to right that power imbalance, to make it so that providers will treat people with respect. But it really makes me sad that their doctors and nurses will treat people differently when we're not there. And that pain is so hard for me to think of. So what about all the families we're not there with? Because we're really just there like a small drop in the bucket. If it's 1,500 babies at this hospital, we're only there for 100. But hopefully we're there for the families that really need us. And I will say, though, too, over the years, so we started organizing in 2017. 2021, I was the very first paid birth helper. So this is my job. I get to do it as a job. There's been a shift inside the labor and delivery unit. So the nurses and the doctors and the midwives, they all say having us there is creating positive change for their whole facility. And it took time, though, for that partnership to build. So we had to build trust, we had to create connections. In some ways, we were privileged because Margaret worked within the healthcare system. So she was a big piece of it too, creating change from within. So we kind of took it from like a multi-pronged approach to get to where we are. But I think just holding that, like, what do I want for my people? What do my people want? And then how can we use our privilege to get there and to stand up for them? And over time, we really have seen a big shift. Yeah, I'm just looking at the
Thank
chat,
you.
not sure. Yeah, thank you.
Abra, and I just wanted to say, like, I completely resonate with everything that you just said. When I was working as a registered nurse, I worked in the labor and delivery unit for almost 2 years, and it was like some of the best work that I've done, and I was very passionate about it, but seeing the same things within Canada or Nunavut specifically, where Iqaluit is one of the only places in Nunavut that you can give birth in the hospital there. I think that the rest of the territory, except for a couple of the health centers that do have midwifery services, which I think are no longer available. It, it- and like, I'm just trying to get back to that, like, why a continuum that fits for all of our areas of work is so important, because then it's Inuit-led, it's Inuit-informed. We get to decide what the pillars of our healthcare and what our wellness is. And that's something that when I was working as a nurse, like, there was such a disconnect, because when you're working in the hospital, and for me working as a labor and delivery nurse, it was so medical specific, and for good reason in some areas, but a lot of the aspects of birth and labor and delivery and starting off that life in the right light, I guess, are not a lot of the times medical. So the thing that I struggled with was, like, where do we get to decide what is important to us and how it's important, and who gets to be involved in the room, in the labor and delivery, and what aspects of our culture and our traditions and who we are as people get to be incorporated into birth. And I think that, like, there's such a like, it's such an important thing to incorporate into our lives, because when you start off your labor and delivery well, and you get to do it in the way that you would like to, then you start off your journey as parents or as a mother, in that right way, I guess, or in that, like, the way that you want to. So I really resonate with what you said, and I think that it really emphasizes the importance of having a continuum of care that fits all of our area, like all of the areas of our health and wellness as Inuit. So thank you, Abra. I see Naomi's hand is up. Abra, I'll give it back to you, and then afterwards, I think we can have Naomi speak.
Yeah, I was just going to say one thing I didn't share in my presentation that I like to say is that a, a lot of traditional beliefs are that where you're born is where you're tied to that land. So if we want strong Inuit, we need to build strong homelands, we need to give birth on those lands too. So what does it mean for the future of our people when we think about where we give birth and where we're tied to? I was born in Anchorage and I'm here again. I came back here, so I think about that a lot too.
Thank you, Abra. Okay, I'm going to unmute you, Naomi, and then you'll have access to unmute yourself, and then you can ask your question.
Melinda. First of all, thank you guys for allowing me to participate in this. I think it's amazing. This really resonates with me, like the whole idea of having available midwifery in our smaller communities is so important. And just touch, because I'm from Iqaluit, and touching base on what you said, Melinda, about everything is so medically led, and how all these moms to be or mothers have to travel to Iqaluit from those smaller communities, but also if things get complicated, they have to go even further south. Like my cousin, she's having twins and she just left to Ottawa. She's been there for a few weeks now, her and her partner, and she had to leave behind her teenage son who is staying with my uncle, his grandpa. And so it really, having to have this happen really disrupts that way of life and like all around. And so I think, because like I work in infrastructure for one of our Inuit organizations, and it's all interconnected, what from housing to midwifery to healthcare and all that. And I think like these discussions are important to have with our Inuit organizations to look at, what do we need from a healthcare perspective to make sure that everything is culturally appropriate and Inuit mothers are supported. Like that's a huge gap. So that's just my perspective on it.
Thank you, Naomi, and nice to hear your voice. Yeah, do you have any final reflections, Abra?
No, I can just relate to that too. I'm thinking of a mom I supported who was also having twins, and how frustrating it was for her to leave her community. And yeah, I'm really proud of her for how she stood up for herself during her labor too, because she had so many twins on both sides of her husband and her side of the family. So the policy at the hospital is that they go to the operating room, but she didn't want to, and that was really hard for the doctors to deal with. But we have a right to decline everything within our healthcare system. It's just whether or not you can speak up against it. And so she opted out of the operating room. And it was really amazing to see her be really strong in that conviction. And then also balancing the difficulty of her being away from home for so long and away from her job and her family and her younger children. So we still have so much further to go, I guess, I'm so excited about what the changes we're creating, and then also excited to think of what we can dream collectively in the future. And I will just say quickly, in the Q&A, I see, how were you able to create your own guidelines process? I feel that sometimes it's hard to manage the best practice regulated from the government and insurance versus the best cultural practice. So we're totally separate from the hospital system. We're a community-based organization, and we've developed our policies and procedures over years, so almost 10 years now. And we're responsive to community, so we really just listen to what community members want and then adjust accordingly. yeah. Thank you, everyone. And if you have more questions too, you can always email me.
Yeah, absolutely. And I guess I wanted to share one reflection, and I don't know, because I was in the background dealing with a few other things. But Abra, when I first met you and you presented at the Inuit Women's Summit, you had made a statement that has stuck so closely with me throughout my work and my life, and just raising my boys here and watching them grow. But you had made a statement along the lines of like within our communities, the birth is such a beautiful thing, and like that should be celebrated, and that should be celebrated as a community, and that's how we traditionally did it. And now in our modern Inuit life, we see a lot more death and funerals than we do births, and so that takes like it just goes back to that full circle moment where, you know, we need more to celebrate within our communities. We need more to look forward to and to uplift other Inuit. And I think it goes back to the very beginning, like being able to celebrate that birth and that life right from the beginning is such a important part of our traditions and our culture. And I think that like we need to find ways to implement that and to go back to that full circle continuum of care right from the beginning all the way to the very end of life. And you know, when we're able to give birth in our communities and around our families and within our community, we get to have that opportunity to celebrate not only with our immediate families, but then you get to go to the grocery store or out for a walk or wherever it is, and you get to see your elders or your aunts and uncles, and you get to like celebrate those moments with them. But when you're pulled away from home to do those medical things, then you're not able to celebrate in those ways and to have that support that we do within the communities. So yeah, that's something that stuck with me when you presented in Sissimute in October. And yeah, I really appreciate your presentation today, and for you kickstarting the ICC speaker series in such a positive and beautiful way. And we really are honored to have you here as a presenter, and thank you. Um, yeah.
Yes, thank you for bringing that up, Melinda. I think birth is the ultimate ceremony. It's the number one like rite of passage, and we were all born, and traditionally we were born into beauty, uplifted and supported by revered community members. And the midwives who supported birth traditionally too, they had that reciprocity with their community members. So the baby knew who the midwife was, and I've even heard that from elders. Oh, the baby likes my earrings. um, from elders saying like they knew who the midwife was who delivered them, and they loved her and cared for her. So what would it look like for healing to reclaim that role of that reciprocity and those reclaiming those ceremonies too of just being born into beauty and being born surrounded by loved ones. It's just it's really, yeah, it's special.
Yeah, so special. And I think that we're out of time. Thank you so much, Abra, for your beautiful presentation, and everyone for being here, our translators. And Corinne, is she here? She is, good. And next week, I hope to see you all again next week. We will explore promotion, culturally grounded practices that promotes wellness, resilience, and identity. Hope to see you all there. If you have any questions, you can, message us, I think, Melinda.
Yes, yeah. So I was just going to say my contact information is within all of the posts and emails that have been sent out. Please feel free to share within your networks if you think that this speaker series would be beneficial either to you or your peers or to any Inuit organizations that might benefit from the information. We will have 6 or 5 other speakers over the next 5 weeks. And next week we get to invite Iñupiaq based out of Nunavut to come and speak on some of the programs that they deliver for Nunavummiut and Inuit within Nunavut. So that'll be a really all of the episodes of the series will be very special, and it'll be a great opportunity for us to unite as Inuit and to highlight and showcase some of the really amazing things that are happening within our communities and that maybe sometimes don't get enough spotlight. So very excited to invite future speakers. And if you have any questions, comments, or feedback for future webinars, then please feel free to reach out. All of my contact information should be within the posters that were posted on our social media and through email. And Abra has left her email within the chat function. So if you have any direct questions to her, please feel free to reach out to Abra. And we hope that we see the rest of you come back for the rest of the series. And hopefully next week we will have the Inuktitut translation working. I really do apologize for that delay. But I think that next week it'll be all ironed out.
Bye, everyone.
Thank you. Take care.
Take care. I love all the thank yous in all our dialects.
Me too. Me too.
Beautiful.
I tried raising my hand, but I guess it didn't show. But
Oh, it did show. We thought that it was up on mistake, maybe.
I just wanted. I'm really sorry I missed this beautiful presentation. I grew up with a midwife mother, and it brings this subject is very special to me, and I'm glad that things are moving. And it is a celebration of birthing, and the cultural practices connected to it, I think, is really amazing. Nakomi.
Thank you, Minnie. And we look forward to having you in a future speaker series as well.
And this is recorded too, so we'll be able to go.
Yes, so I can circulate the link as well.
Thank you. Nakomi.
Naomi, I see that your hand is still up. Did you have one final question?
No, sorry, I didn't realize I didn't lower my hand.
Oh, okay. No, that's okay. That's okay. Thank you so much for your questions and for engaging. And we hope to see you in future series.
Yes, I'll be there. Thank you, guys.
Okay, well, thank you so much, Tupangnak, and thank you, Abra. You guys did amazing. I'm so sorry for the technical issues.
No.
Hopefully for future series, that'll all be worked out, but you both did wonderful and really appreciate having you with us, Abra, and on your wonderful presentation and seeing your baby too.
Yeah, it was beautiful. Thank you for having me. I'm honored to help kick off this series. I can't wait for the next ones.
Yeah, absolutely. And thank you, Tupangnak, for your wonderful facilitation and making things work so smoothly while I was rushing around in the background.
No worries. I'm glad it all worked out. And Abra, how do I say your name?
Abra.
Abra. I hope I get to meet you in person one day.
Me too. Me too. I would love to visit. I'll
Yeah.
see if I could work that out when I'm hoping to come next summer.
Oh, that'll be so great. Oh, baby.
She's breastfeeding. She just stopped to say,
Aw, so sweet.
her little voice.
So special.
Oh.
Did
Okay,
I mess up with my screen sharing? Did you guys see everything on my screen, or did you just see the?
it was just
No.
a presentation. Yeah.
Stressed out about that.
No, it was all good. Everything was good. So I'm gonna stop recording now, and then I'm gonna end the meeting.